today we're going to talk a little bit about suctioning babies, young children, in the setting of any increased work of breathing, any complaints on parents on poor feeding. That's a huge one that I'll loop back around to. But for the purpose of today, I'm just going to mostly show you how to suction and things to be aware of, as well as some discharge teaching to do with parents when you're getting ready to send them home. During the winter months, this is a super useful, frequently used skill. And the things to really kind of remember is that saline is imperative. Okay. As far as needing equipment, you want to have saline. The Boogie Baby is what we use here. You can actually order this from the storeroom. They should be stored on the unit, called Boogie Babies. And it is, it's like this out of the package. And they're great. Great, great, great. So this is what you're going to want to use. We do have traditional bulb syringes as well. In a pinch, these are great, but if you're really looking to clear airways effectively, this is our tool of choice here in the ER. This is good for home, and we'll talk about some other things that we can send people home with suggestion-wise. So, the first thing to note is obviously if I was doing this in real life, gloves, eye protection, mask. If you're questioning RSV in a child, then you should also have a gown on at the time you do that. That's the precautions that are used. The other thing to note is positioning of the child. You can do this in a child of any age that will tolerate it. So realistically, when they get to be late toddlerhood, this becomes very difficult. They're bigger, they can move around, and you can't do this. Mostly done in infants. One thing to keep in mind is even if parents don't endorse stuffy nose, runny nose, but bring a particularly young child in and say all of a sudden they're not feeding off the bottle, when I put them on the latch, they keep trying and then come off, that is often a result of their nose being plugged up. They are obligatory mouth breathers, but when they're nursing or they're taking a bottle, they need to breathe through their nose. They become easily stuffed up, they can't feed, often present with complaints of poor feeding. So keep that in mind. Even if the parent's like, no, there's no runny nose, no stuffy nose. This is worth a try with any kid that comes in with poor feeding reported. As far as positioning, it's a couple things you can do. I usually swaddle into a blanket. Two options here. If you have other hands on deck, you can leave them on the stretcher. You want to put the head up about 45 degrees or so. This is a hard one to have parents hold for. They have to be a pretty good holder if they're of the older age. Other options, if you're by yourself and you really want to get this done in a pinch, a car seat in an infant is a good positioning tool for you. You can put them back in the car seat. They generally have the little head thing, so it keeps them from flailing around too much. And what you'll need is your wall suction. And I usually set mine to like a medium high on continuous. If you're getting really not getting a lot out, you can turn it up a little more. Your Boogie Baby simply goes in, and that just functions just like a yank bar. In the ER, we don't have nasal saline. It takes forever to come down from the pharmacy. You can order it. No, you can order it. If you're going to be doing this a lot, you might want to. But what I generally do here, take an atomizer, and this will stay with the child while they're here in the ER, so don't throw it away every time you use it. We'll take our atomizer, turn it on the saline flush. I would say, obviously, the older the child, the more saline I use, but generally I use probably between a half an ml to 3/4 of an ml. Again, it's not an exact science, per nostril. Okay. So what you're going to do is explain to the parent what you're doing, get the child in a position of comfort best you can. Okay. Head up. Have all your stuff ready to go. I generally put that right on their chest. I have this here. I have my gloves on. Okay. Stabilize their head. Take your nasal atomizer. Generally go in, and I'm going to do like half a cc, 3/4 of a cc, and I'm going to go right in with this, and I'm going to suck. I'm going to move it around quite a bit in there. It's got a soft tip, so you won't be doing any trauma. It is super helpful, in all honesty, if they cough or sneeze or even crying a little while you do this, because then it helps get the secretions that are further down in the nasal pharynx up as well. You do one side, and move to the other. Again, going nice and quick with my thing. Wiggle it around a little. You usually get more from one side than the other, but I'm gonna see, I might revisit the other side, take a look, give them a second. I do, if I got a lot, I will often go back and do a quick other pass. So just a little more saline. By now they're probably crying pretty good, so. And then just suck it right out. More saline. Good suck. Okay. And again, don't be too shy about it. Make sure you have a good seal. Kind of wiggle it around. Rotor-rootering. Okay. And then give them a break. Ideally, generally, kids like this, I would have on the pulse ox anyways, because they're coming in with complaints, potentially, of respiratory issues. Other things to note is you can leave this all in the room. Okay, so usually just wrap it up nice and clean, put it back in the package often, or the suction package if I get that. Tuck it back in there, let everybody know it's there. Don't be afraid to do this. You're not going to do any harm. They don't like it, and I do, I'm very honest with parents. I'm like, they're going to hate this. But in the end, I'll do my thing. If they're not any serious distress, I will then say to parents, let's go ahead and try and feed them. Let's go ahead and try and nurse them. And more often than not, leave them be, let them calm down, let mom and dad take care of it. You'll come back and they'll be like, oh my gosh, they ate 3 ounces. They haven't eaten 3 ounces all day. So it's huge. You don't need an order for it. This is a nurse-driven procedure. And I would urge you to use it early in their visit, because it will, if they're going to go home, it will cut down the time in which they're here. I also use this on the kids that end up in K2. You get really little ones, get brought in, they're really working to breathe. The first thing I do is grab this and suck their nose out. Get them on the pulse ox. People can help you with that. My first favorite thing to do is to grab this. And you'll be amazed how much it will drop, particularly a newborn's work of breathing. They'll look like $1 million when they did not look like $1 million 4 seconds ago. So use it early. It's a great intervention. Often after doing this, they get discharged from the ER. So for discharge teaching, obviously parents do not have this available at home. The second best thing is the nose Frida. And this is kind of grosses parents out, but just assure them it's super, super effective. And you can buy this at any store. They're about 12 or 13 bucks. They come with a little bit of a filter that they put in there. Pop them out. Slides in there. Obviously you don't really know to not do this, but this is what it looks like when you get it at home. Okay, and it's like a pipette. You could actually get an amazing amount of suction off of this. Again, there's a filter in there. Parents would be the ones doing this. They're already with the child. And then I asked them to stop and get some saline. It doesn't need to be anything special. This is an example of a nasal saline. We sell it up in the pharmacy. It's a little squirt bottle for like, I don't know, $3, not much. And you want to instruct parents, when you take the child home, you need to suck their nose out. Do as I did. And I will often ask them to kind of talk me through how they're going to do it at home if I don't have the exact supplies they're going home with. Saline first. Nose feeder again. They want to do that whenever they're going to feed. So before every feed, before rest time, and before bed. That's what I suggest. They'll sleep better, they'll eat better, they're less likely to end up back here. They'll do that through the course of the illness. If they do find that it's not making any difference, the child continues not to eat or continues to have work of breathing, they need to return here. The other option you can send them home with, if they don't have a nasal Frida, or if they are just totally resistant to the idea, sometimes happens, is a bulb syringe. These are good. They're not super awesome, but they're what we have. They don't do good for the real thick, like caked on boogers. They would still need or be advised to use saline first. Okay, so same deal at home. Before feeds, before naps, they're overly congested. Saline, depress the bulb. Takes a bit. You want to have kind of a good suck. I tend to go a little slower, like this is probably the speed I like. I think you get a little more bang for your buck. And again, you would teach them how to do that or ask them to demonstrate that for us. This is something we have in the ER that you can send them home with. A lot of parents have these because they send them home when you have your baby. They send them home with you, but if they don't, but we do, these are great. They really are. These will be a lifesaver. This will prevent readmission to the ER if they're used correctly. So again, that's kind of what we do for suctioning here in the ER. Don't be afraid to use it, be aggressive about it, and be quick to use it.